lately, if you've been watching news clips with progressive candidates and perhaps anyone that mentions Medicare for all, the number one question that they are always asked is, how are you going to pay for it? And thankfully, I have someone here with me today that actually knows how to answer that question. Her name is Andrea Witte. Andrea, welcome to the program.
Hi, Mike. I'm a big fan of your show. Happy to be on.
I'm a fan of you as well. For those of you who don't know, Andrea is an individual who is really rare. She likes math. And what's great about Andrea is she can kind of break things down in a way that is really easily digestible. So when she explains math to me, it actually makes sense. So tell us about what you do, because you're a graphic designer, you're the founder of ConnectTheDotsUSA, and tell us what your YouTube channel focuses on.
Right. So like you said, I'm a professional graphic designer for the last 25 years. I've had my own business, and I got involved in politics and activism during the healthcare fight of 2009 because I buy my own health insurance since I started my business. So I'm very familiar with the individual market. And so that's why I got involved. And then I decided we have an education problem. And so I decided just to put my graphic design skills and my love of math to use. And so I created what I call they're easy to understand, easy to share, informative eye candy on today's most complex issues. So that'd be healthcare, the federal budget, and jobs in the economy are my top three.
And they are very, very thorough, but they're also very easy to understand for the average person. And you are really great because even certain politicians, I don't know if we can name names, are allowing you to give presentations for them, explaining how we pay for things.
Yeah. So I live in Tucson, Arizona, and Raul Grijalva is one of our representatives down here. He's in the neighboring district, but I always think of him as my representative because he's just a champion progressive. And he always calls me the professor when he sees me. So he's invited me sometimes to come during one of his town halls and do a presentation about healthcare, or recently about the Trump tax scam, and just kind of break it down for people in a visual way.
Right. And as she tells us how we pay for certain things, you're going to see why she's so useful and so helpful. So, Andrea, when it comes to the question, how do we pay for Medicare for all, that progressives are always asked, how do you answer that question?
Okay, well, we can start by talking about the fact that about 2/3 of all of the spending that we do on healthcare right now is already tax financed. So you sometimes hear that big number. We spend just over $3 trillion a year on healthcare in this country. That's about 18% of our economy. And that's, the next nearest country is about 12%. So we spend an enormous amount on healthcare. So the money's already sloshing around in our healthcare system. It's just being spent very inefficiently because of all the different payers and the different programs and the cost sharing, and you've got private and you've got public. But when you realize that 2/3 of all of our spending is already tax financed, it doesn't sound like that big of a leap anymore. And plus, Medicare-For-All system will save an enormous amount of money because you're just going to have one payer. So right away, you're going to save money overall, and that will use some of that savings to make existing Medicare more comprehensive, and then also will end up net saving money. So that's the beginning of it. We're going to get into a lot more details.
Can you kind of go over some of the key points? A lot of people like to cite the new number from the Mercatus study that there is 2.1 trillion in savings. So what do you think, if you can do some bullet points for us, what are the key benefits of switching to Medicare for all in your mind?
Okay, so the main thing is the moral argument that everyone is now covered. So, and it's not about having just access to insurance, you actually have health care. So the federal government becomes the single payer that pays all the bills, and that's the only difference. The doctors and hospitals and providers are all still the same. They're mainly in the private market like they are now. It's just we get rid of all the complexity, what I like to call a crazy quilt, because we have such a big hodgepodge of different systems. So So that's like the big thing. So the big thing is we get everybody covered, which with much more comprehensive coverage, and you have much greater choice of doctors and hospitals than most people do now with their insurance, and we net save money. So as you pointed out, we had this right-wing libertarian Koch-funded group that ironically, they're trying to do a hit piece on Medicare-For-All, and it turns out buried in their main table that it would net save $2 trillion. So we always have to compare to the cost of our existing crazy quilt. So in that Mercatus study, it was called by Charles Blauhaus, the numbers that you want to compare is he in table 2, it's row 6, because I've been talking about this particular study for a while now, since it came out. If you look at table 2 on row 6 and you total up those numbers, the total cost of our current system over that decade, he has at $59.7 trillion. And then you add up row 9, where he has the total cost of Bernie Sanders' Medicare-For-All plan as $57.6 trillion. There's the difference of $2.1 trillion. And I have a nice graph, graphic number 9. If you want to put that up for your viewers, that shows it really nicely. And you can see where the savings come from. So this is from a libertarian funded study. So it's, if anything, they're going to be pretty measly with the estimated savings from Medicare-For-All. And even they had to admit that it saves $2 trillion overall. So of course we can figure out a way to fund something that costs less than what we're spending now. It's just a matter of shifting some of the money around. It's not new money. It's just shifting money from how it's being spent now by households, employers, and state and local governments. And we're just going to be shifting that to the federal government, adding on to what the federal government already spends in our healthcare system for things like Medicare and Medicaid and all the federal programs. So we apply that existing spending. So in that Koch-funded study, he then applies all the existing federal spending of about $22 trillion. And then he says, okay, then the federal government needs to raise another $32 trillion on top of that to fund Medicare-For-All. So he wanted to focus the attention on that $32 trillion, but that was just the increase in federal spending. It wasn't the total. And the first response when somebody says, oh, well, Medicare-For-All is going to increase federal spending, your first response should just be, duh, of course it's going to increase federal spending. That's the point of single payer. But it's so because all the spending is going to shift to the federal government, but you're not going to have, it's going to replace the spending that is currently being done very inefficiently by households and employers and state and local governments. So those are two different numbers. And unfortunately, people are getting really confused by that 32 trillion because the corporate media, the insurance industry, certainly the right wing, they want to focus on that big number of increase in federal spending, and they don't want you to know about that Medicare-For-All saves overall. So this graph, I sort of was inspired. Sometimes I see graphs that are really good. And this one from Matt Bruning of the People's Policy Project, he's just been doing amazing math checking on this Koch study. And he was one of the people that discovered that $2 trillion in savings in the table. And he's just been correcting a lot of bad math. So I thought this graph really simplified it. So over on the left, you see our current status quo healthcare system, what I call the crazy quilt, and yellow represents federal health spending. So you can already see the federal government is spending $22 trillion in our current system, right? And then red represents all other spending. So that would be by households buying private insurance, cost sharing for deductibles, co-pays, co-insurance. You've got employers buying private insurance, and then you have state and local governments buying private insurance for their public employees, and also funding things like their portion of the Medicaid program. So Medicaid is the program for low-income people, to distinguish it from Medicare, which is our current program for seniors 65 and older and the disabled. So anyway, so the red then shows all the other spending that's going on in our current system. All right. So now when you look at, this is the Koch-funded analysis of Bernie Sanders' plan, you see, yes, the yellow goes way up, but what goes way down? The red. Okay. And you see the growth in the yellow there is that 32.6 trillion that they're fixated on. But the important point that they don't want you to notice is that the total size of the bar, the height of the bar, yellow plus red together, is shorter under Medicare-For-All, because there's your 2 trillion in savings.
That's such a helpful graph.
Isn't that? So yeah, helpful. Matt Bruning did a good job on that. So, and then where progressives are making the mistake in the calculation is they're looking at that growth in the yellow bar. So you see that 32 trillion, and they're trying to compare that to the total, and they're going, okay, the 32 trillion plus, I know I've heard 2 trillion savings, and then they're adding the 32 to the 2, going 34. But wait a minute, last week I was saying that total spending on our current system over a decade is more like 49 trillion. So how did it go down? So you see where the math got like all messed up. And a lot of it is because of the headlines. The headlines that say Medicare-For-All is a cost $32 trillion. That's a really weird and confusing way of talking now that you see this graph. That's just the increase in federal spending. And even in the Mercatus study, he very clearly labels that increase in federal spending. But the way the media is spinning it is to say Medicare-For-All costs 32 trillion. No, it actually costs 57.6 trillion, but our current system costs 59.7. But you can see how people are getting confused. And I tried to make this an analogy in one of my videos about how weird it is to talk that way, because it's just not, that's just not a correct way to speak. The headline, if you wanted to do a hit piece, you would just say Medicare-For-All would increase federal spending by 32 trillion. According to the study, right? That would be at least accurate according to this study, but it wouldn't be misleading. Like the Medicare costs 32 trillion, and that's what's throwing everyone. And so I made this little analogy, a little word problem. So get ready for a word problem. Let's say, I'm going to make the math really easy. Let's say Mary is thinking of moving from apartment A to apartment B. And that's going to cost her another $500, which represents a 50% increase. Working backwards, that means apartment A is $1,000 and apartment B is $1,500. It would be really weird and misleading to say apartment B costs Mary $500. That's the change. That's not the total, but that's kind of like analogous to the headline Medicare-For-All costs 32 trillion. That's the increase in one thing. It's not the, and it's not the total. And it's also not, for example, Mary's total monthly living expenses. So now to continue analogy, let's say that I give you a little more information. It turns out that apartment B, unlike apartment A, includes all utilities. There's a fitness center on site, and it includes a washer dryer in the apartment. And it turns out not only can Mary get rid of her gym membership, she can also get rid of all of her car expenses, because now she can get an easy pass on the nearby metro line. All right, so now I give you a little more information that her total monthly living expenses with apartment B is $2,300, and her living expenses, if she stays in apartment A, is $2,500. And then if I ask you what's the difference in the living expenses, well, it's a net savings of $200 if she moves. So even though her rent went up, that's the federal spending part, her total monthly expenses went down. And notice how we didn't invoke the $500 when we did the calculation of the change in her monthly living expenses. So that study had really measly estimates of savings with Medicare-For-All, because obviously they didn't want to be too generous about how you save in administrative efficiencies and negotiating drug prices. And single payer advocates, hey, we'll take the $2 trillion. That's great. But Himmelstein and Woolhandler, who are co-founders of Physicians for a National Health Program, they put out an article, and I've done some graphics on that as well, that say, oh, yeah, but you're missing another 10 trillion in savings, Mercatus study.
Exactly.
And they break those out. So, for example, they say in that study, he based it on assuming that we can get the overhead on insurance down from 13% right now to 6%. But our existing Medicare system operates at an under 2% overhead.
Right.
And that's how almost every other civilized country that has a single payer type system has less than 2%. So if you plug that in to the equation, you save another $2.9 trillion over those 10 years. And then he doesn't even, in the Mercatus study, he doesn't even account for all the administrative efficiencies on the provider side, meaning doctors and hospitals now can really cut their overhead. Just think about how much time they spend calling insurance companies and billing and all that stuff, right? Mercatus, the Charles Blauhaus and the Mercatus study doesn't even factor that in. And that's like another $5.4 trillion in savings if you add up all of that administrative efficiencies. And then the study also doesn't really factor in really negotiating down the prices of drugs, just like every other civilized country does, as well as our Veterans Administration and Medicaid programs do. He just estimates that we're going to switch to more generics. And get the price of generics down, but never really tackles getting down the cost of these brand name drugs, the $600 EpiPen and all of these these prices. So if you factor that in, you get another 1.7 trillion in savings. And so that's how they come up with, $10 trillion more in savings. And I think just for your viewers, if you wanted to show them graphic number 12. So I've got the Mercatus Blauhaus study on the left showing where those savings come from. And he's already factored in increased utilization of healthcare now that everybody's got coverage, the more comprehensive benefit package. And so I've got that on the left side so you can compare. And then this was an article that Himmelstein and Woolhandler, who do a lot of studies and articles about single payer. So I kind of just summarized that over on the right. Now, they may be a little more generous, but, we can kind of split the difference. The important thing is that even this libertarian study admitted that we can cover everyone with much better benefits, much greater choice of doctors and hospitals, and even save money, whether that's 2 trillion, 5 trillion, or 12 trillion. That's a huge bargain. And so, yeah.
10 trillion is essentially a number that would be accurate if we wanted to pitch Medicare-For-All. And let's say I'm Alexandria Ocasio-Cortez and Chris Cuomo says, how are you going to pay for Medicare-For-All? If I say 10 trillion, that is technically correct, according to the David Himmelstein.
Now, that's not an extensive study where I can dig into tables and things. So this was just an article they wrote based on other assessments. So I'd like to try to dig into it more. And we can dig into another study that I had teed up by Gerald Friedman, who he's one of the few economic economists who's willing to courageously put together not just how much savings would get generated, but then put together a package of tax revenues to make up the difference, right? So we heard from the Mercatus study, oh, okay, you're gonna have to raise 32 trillion. But wait a minute, if we have another 10 trillion in savings, then we only have to raise 22 trillion, right? So you see how that works. So that's why pushing back a little bit on that, hey, I'll take the 2 trillion, like Bernie's been saying, that's great. But they're trying to say we need to raise an additional 32 trillion in federal. Whereas if you show more savings, then maybe you only need to raise less than that. Maybe it's more like what Bernie's saying, 16 trillion or 20 trillion. But remember, whatever we're raising, we're getting rid of all we're replacing. So it's not new money introduced in the system, we're replacing. And so always keep that in mind. So even in the Mercatus study, when he says we have to, raise federal spending by 32 trillion, but even he admits we're decreasing spending by 34.7 trillion by households, employers, and state and local governments. So it's just an accounting shift.
It's so easy to get misled because there's the way that you explain it makes so much sense. Now, do you have the Friedman study?
Yeah. So the Friedman study is going to be, first, if you want to pull up graphic number 1, this is where I talked about, don't get scared about, oh, how are we going to do all this? Because like I said, 2/3 of all spending, healthcare spending in this country is already financed by taxpayers. So you have the obvious one, almost half of all the spending is public spending for programs like Medicare, Medicaid, the Affordable Care Act subsidies, the VA. So all of that you can see there. But the part that people miss that isn't as obvious is you have another 6.5%, a couple $100 billion, that is where state and federal governments buy private insurance plans for their public employees. That gets classified as private spending in some charts, when it's totally tax finance. And a lot of that is at the state level. So that would be for people like school teachers and people that are state level employees. And then the one that's even more hidden is those tax subsidies for private insurance. And the big one is the employer provided health insurance. So the employer, on average, an average family plan is $19,000. I think that's this year. The employer is kicking in $13,000 and the employee is kicking in nearly $6,000. Just think about that. And of course, that's ultimately coming out of everybody's wages. But that employer takes that $19,000 as a tax. It's expensed out, right? So it doesn't show up on when they file their taxes, but it never shows up as income for the employee. So that's called a tax expenditure or a tax subsidy. And that adds up, you can see from this chart, to another 10% of that total spending. So when you look at it that way, okay, well, 2/3 of all the spending is already tax finance. So we're just going to do a little reshuffling. That's what we're doing. So we're going to take all that existing money and just redirect it into expanding existing Medicare and improving that and enhancing or improving it. And I say that because people on existing Medicare, like my husband, he's a little bit older than I am, they will tell you that existing Medicare, while we love it, we want to improve it at the same time we expand it. So we want to get rid of the gaps. There's some deductibles and cost sharing that cause people to have to get a supplement that might cost them $100, like my husband's is $135 a month. And then Medicare doesn't cover things like dental, hearing, and vision. And so dental can really add up for people. So part of the movement and part of all of these bills that we talk about, whether it's HR 676, the gold standard bill in the House, or Bernie's S 1804, which is his current Senate bill, all of them include improving, enhancing existing Medicare. So that's sort of like built in already when we talk about Medicare-For-All. So there won't be any premiums in Medicare. There'll be no deductibles, no co-insurance, and then we're going to have benefits are going to be much more expansive. So dental, vision, hearing are the ones that come immediately to mind. So
now you mentioned HR 676 is the gold standard. If we can get to why it's the gold standard, but Bernie Sanders' bill isn't as good, what are the differences there?
So the main differences, they're both very good, but the main differences are that HR 676 would start January 1st of the first year when it's passed. So if it was passed in this year, it would start January 1 of 2019. Bernie's plan has a 4-year rollout, gradually lowering the eligibility age. And the first year it would go to 55, and it would also include children 0 to 18, and then the next year to 45, and the next year to 35, and then everybody would be included. And in the interim, people would be able to, buy into existing into the Medicare program, kind of like a public option. So he has that in there. I don't personally have a problem with it in theory. to gradually do it. But we saw what happened with the 4-year rollout of the Affordable Care Act. And you just set yourself up for sabotage and, the right wing and the corporations trying to undercut it. And also you don't see the full benefits, just like with Obamacare, when a lot of the good things didn't happen until the 4th year, right? When pre-existing condition discrimination went away and all that stuff. And so I just think it's a mistake. We've waited long enough. It's time to just rip the Band-Aid off this.
Right.
And, and just start and get this done. So that's more my feeling about it. The second probably bigger issue is that Bernie leaves long-term care at the state administered level. So right now, long-term care is kind of a shared federal state program, and it's done through usually Medicaid. And the states administer it. It also means they means test it. So most people that are in nursing homes right now, they've done a spend down of all of their assets, and then they qualify for long-term care and Medicaid, because most people cannot afford long-term care policies. They're very expensive and to maintain. So I think those are the two biggest ones. A third one is that HR 676 would forbid any investor-owned medical facilities, whereas Bernie's plan still allows them. And as long as you have Wall Street mucking around in our healthcare system, they're always going to be putting pressure on hospitals and doctors' practices to just keep cutting services. And so I just think that one's a mistake too. So our goal is to kind of just get Bernie back to his 2016 campaign plan, which was more similar to HR 676, and not go the other way, because there are some rumors going around that there are people in the House that are trying to go the other way and water down HR 676 to look more like Bernie's plan. And my feeling is this isn't the time for compromising. This is the time for articulating what we really, really want and fighting for that. And if we get down to the wire at the very end, then we're not going to do the Obama thing where we compromise before we get to the
right.
the table, right? So those are the main differences, I would say.
Okay, that's very helpful. Now, one thing that I want to, because as we go through all these numbers and whatnot, there's so many selling points for Medicare-For-All, but I do want you to go over an error that was made by a lot of progressives, myself included, because one article from the Daily Kos posited that Medicare-For-All would result in $17 trillion in savings. That is factually incorrect. You actually reached out to the author of that article. He has since corrected it, and it is a number that misleads a lot of progressives. So can you explain why that was wrong?
This was the mistake that we talked about before of trying to compare an increase in something, federal spending, to a total national health expenditure. So we kind of went over this a little bit before, and completely coincidentally, the number 32 trillion is involved. Even though this was for an earlier decade, the Mercatus report that we were talking about earlier, the Koch funded one, that one is from 2022 to 2031. And the reason they started then is because Bernie's plan has that 4-year rollout. So even theoretically, it couldn't even be fully implemented until 2022. This Daily Kos blog was based on a complete misreading of a 2016 Urban Institute report that was analyzing Bernie's plan from the campaign. And so the Daily Kos blogger actually clipped this table like the way I have it here, except without my red circles on it. And so when I kept hearing the 17 trillion savings number from a bunch of YouTubers, I was like, boy, that number is a lot bigger than anything I've seen in all my studies of this. So I immediately went to the link, and then I'm reading this art and I see the table. I was like, that's not what the table says. So he just completely missed what was very clearly marked as an increase in federal spending. He misunderstood that as a total. And then he went and wrote this diary figuring out that our current system over that decade of 2017 to 2026 would cost 49 trillion. He subtracts the 32 trillion from the 49, goes 17 trillion in savings. Well, he didn't even need to do all that work because, Mike, if you look at the line item in that same table that he clipped right above, it says that the overall spending will increase by 6.6 trillion. So he didn't even need to go figure out all these totals. It was already there. that this was a complete hit piece on single payer, which is why single payer advocates at the time in May of 2016 criticized it immediately as underestimating savings, overestimating increase of utilization of health care, and then actually not analyzing Bernie's actual plan.
Right.
They left in a bunch of private Medicare Advantage plans that Bernie clearly said are not going to be part of the new plan. So that report was roundly criticized, and it belongs in the dustbin of history. And I wish I never had to bring it up again. But because this Daily Kos blogger completely misread it, it was like, people stop saying this. I don't like to overpromise and underdeliver. I'd rather underpromise and overdeliver is always my philosophy.
Absolutely.
So, yeah. And I think he was mortified when I sent him the email.
Right.
And I pointed it out because he did immediately, I think it was the next day he emailed back and he's like, oh, you're right. Thank you for pointing this all out. And the interesting thing he said was, I think I was misled by the headlines at the time. And he quoted one that said Bernie care would cost $32 trillion. And that gets us back to exactly why the propaganda in the corporate media is trying to mislead by focusing on that number because they don't want to focus on the totals. And just to go back to that Mercatus study, Charles Blauhaus must have noticed after he finished the analysis, this isn't going to look good to my co-funders. So what's weird, he doesn't total up certain rows. Like he totals up he's got 10 numbers for each of the years. He totals up the 32 trillion one, and he even totals up the savings one, but he doesn't total up like the total of our current system. It's just weird. Like why? So of course I go in there and I totaled them up, and Matt Bruning did the same thing. And Bernie of course did that too. So when he comes back and tries to say, no, that's not what my report said, you're misrepresenting. No, that's exactly what your report said. You just don't like it. And those aren't Bernie's assumptions, because if Bernie was going to make assumptions, he would more assume that Medicare-For-All would say 5 trillion or 10 or 12 trillion. Why is he going to assume 2 trillion? That was Charles Blauhaus's assumption. So he's just gotten himself in a pickle now, and he's just trying to divert attention to the 32 trillion. So that's the explanation of that. And the Urban Institute, and this is why you have to be careful of what I call fake friends. People that might normally be in alignment with you. The Urban Institute does some good work, and they're about expanding healthcare through Medicaid and, kind of working within our current system. But if you look at some of their podcasts and their writings, they are definitely not single payer advocates.
Right.
Yeah. And you're going to find the same thing with people like, groups like AARP that are normally for, seniors and expanding Medicare and those kinds of things and protecting those programs. But remember, AARP licenses their name to sell Medicare supplements and Medicare Advantage plans, which those things go bye-bye, because you won't need to buy those when the Medicare becomes as comprehensive as we're going to make it. So you have to be careful about people that are normally in alignment with you on other things may not be your friend on this issue.
And what's great is that if somebody has a question about Medicare-For-All and the cost, almost every time a new study comes out, you dig in immediately.
So I'm on it. You told me about the Mercatus study before I'd even seen it that morning. I was like, what? There's another study. And I'm like, I love digging into white papers and then trying to turn them into pretty colorful graphs.
And they're very pretty. They're very pretty.
Jigsaw puzzles or play video games, and I like digging into white papers.
And I like that you're confident. I know before you told me that if anybody wants to check your math, you have the sources there. Yeah. They can try, but it's rock solid. You know your numbers.
I do my best. We all make mistakes, and certainly if somebody points something out, or sometimes it might be that it's not clear. Like when I post something or something, people misinterpret, and I was like, oh, I'll make that a little clearer. When I repost it. So I'm always trying to look for feedback. So just before, I don't want to make sure that we do go and show what a tax package would look like, because I think that's what people need. So so go ahead and then pull up graphic number 2. So this is Gerald Friedman, who is the one I said is the courageous one, who's the only one I've seen besides Bernie who's willing to put together just a a package of those revenue raisers. So this was a study he did that's posted on the Physicians for a National Health Program, and it is a little bit old. He did it in 2013, so it's for the sample year 2014. So it's a little old, but the numbers would just all go up proportionally. So what you do is you start with the cost of our current system. So all that money sloshing around the system, about 3.2 trillion, and then you're going to subtract the savings from Medicare-For-All, which is about 600 billion, 500 billion in those administrative efficiencies now that we just have one payer and we don't have all these different, insurance companies and programs that doctors and hospitals and providers have to deal with. And we have that overhead of only 2% instead of an average of 3%. So that's where that 500 billion comes from. And then Medicare is now going to negotiate the drug prices like every other country does and like the VA does. So that saves just over $100 billion right there. Okay, so we've got 600 billion savings. We're going to use some of that savings, about 350 billion, to make existing Medicare more comprehensive, get rid of the deductibles, add in dental and all that good stuff we talked about, and then expand it to everybody. So that's what's called increased utilization. Now that everybody's got coverage, you're going to see, some increasing utilization of care. And then we're going to increase those Medicaid payment rates. Remember, those are for the program for low income people, and those rates are too low because only about 60% of doctors accept Medicaid patients, whereas 96% of all doctors in this country take traditional Medicare, and just about every hospital in the country accepts traditional Medicare. So that's another big benefit of Medicare-For-All is like my husband right now, he's on traditional Medicare. He can go to any doctor or hospital in the entire country. He's not limited to Tucson, Arizona, like a lot of your private plans and even your Medicare Advantage plans are. So that's just a huge benefit for people. All right. So we're using up. That's why we want those savings, because we're going to use those to get the comprehensive coverage, the better coverage, and expanding to everyone. And then we have about $50 billion in transition costs to help displaced workers, people who are now working in the insurance industry or in billing departments and that kind of thing. And then the money to gradually buy out those investor-owned facilities. Okay. And then, so we had 600 billion in savings. We subtract $400 billion in these costs. And what do we have? A net savings of $200 billion. And Medicare-For-All for the 1 year sample comes in just under 3 trillion. Okay, so those are the two numbers you can compare, right? We don't cross compare. We're not comparing the increase. All right, yeah. So now when we go over to the other side, that's where I put the revenue sources. So you've got, remember, we're going to apply all existing federal spending, all that we talked about, right? Mm-hmm. So we're not starting from zero, like people is like, we're starting from scratch. No. We're starting from about $1.4 trillion in federal spending, okay? And then we're going to claw back, we're going to claw back those tax expenditures of about $260 billion that we talked about, since there's not going to be any employer-provided health insurance. So we claw that back in revenue. And then there's still going to be a little bit of household spending for things like over-the-counter drugs, some elective and cosmetic procedures, and that's about 63 billion. So it's just a fraction of what households are spending now. So 98% of all healthcare spending will now be paid by the federal government, but there's just going to be a little bit. So we put that in there. So then we need the revenue raiser. So then we need some new federal revenue of about 1.4 trillion. And I like to call these replacement revenue, right? Because we're replacing all that money that's currently being spent on private insurance, co-pays, deductibles, and state and local spending on Medicaid and the like. All right. And then he offers up this package. And you could come up with something different, but this gives an idea of what would work. And that would be consistent with the framework of HR 676. So he has a 3% payroll tax on the employer side for income under 53,000, 6% on income over 53,000. So if you were somebody who made 54,000, it would just be 6% on that last 1,000. So it's a marginal, what's called a marginal bracket. And remember, this is going to be on the employer side. Okay. And then there's going to be a 6% income surtax on high incomes over 225,000 and on non-work income, non-wage income like capital gains and dividends. And then a little financial transaction tax on Wall Street. And so when you add all those together, there's your $1.4 trillion. And he ends up having a little surplus, a little cushion of about $154 billion extra to play with there. So that's how it works in a 1 year. And then I did find more recently, if you go to the next graphic, which is graphic, is that graphic 4, where he basically took that and he did a 10-year projection on it. So this is pretty similar, and I'll just say it quickly. So in this case, the cost of the existing system, and we're looking at a little older decade. So these numbers can swing wildly if you're looking at 2022 versus 2016. I mean, when you're talking trillions of dollars and you even just have healthcare inflation in there, medical inflation. So that's why it's very difficult to cross compare. You have to sort of keep your wits about you, because you're going like, well, why is it only 43 trillion? Well, it's an earlier decade. Mm-hmm. We had 59 trillion, we have 49 trillion. Now this is a little earlier decade. So the numbers swing just on our current system, having nothing to do with Medicare-For-All. So we start with 43 trillion. We subtract this, again, the savings from Medicare-For-All, and over a decade, it would be 9.6 trillion, because now you also have, you're slowing the rate of growth, which is huge in medical inflation. And then we have to add back in, just like we did in the 1 year version, you add back in 4.5 trillion for making existing Medicare more comprehensive and expanding it to everyone and all that good stuff we talked about. And then you have the net cost of Medicare-For-All is about 38 trillion. So that's a net savings of $5 trillion. And then you go over to the other side again, and you apply all current federal spending, including those tax expenditures. You get $22 trillion you're going to apply, that little bit of household spending for over-the-counter drugs, just under $1 trillion. And so then that means you need to raise 17.6 trillion in what I call replacement revenue at the federal level. And that's a very different number than 32 trillion. You see how that works?
Right.
I mean, this is a little earlier decade, but still and so then he comes up with, then that raises, he's got about just under 41 trillion. So he's got a cushion there of 3 trillion. So that kind of gives you the idea of, for somebody who wants to see how it would be paid for. Now, you and I like to talk about, this question never gets asked for other spending. Like increasing military spending by $80 billion, all these wars, all the tax cuts, the corporate welfare, the bailout of the bank. No one ever asks, how are you going to pay for it? So this just seems to be reserved for progressive priorities or programs that actually help regular people, regular Americans with healthcare and education. So, and my interesting question, I've been reading more and learning more about modern monetary theory, whether, that seems to be how spending operates for the rich and the powerful, that Congress just creates money by passing legislation. Yeah. So according to modern monetary theory, I guess we don't even need to have the revenue raisers. We just pass legislation and the money just goes out. So that would be a good question for Stephanie Kelton or somebody way more versed, but I'm kind of studying that. Because I know I've seen people say, Andrew, we don't need to raise any of this extra revenue because modern monetary theory. So,
but even if not, like, you have your bases covered. You clearly explain that, yes, obviously we can pay for Medicare-For-All. And in fact, it's not even that difficult. You just made it super simple.
And the important thing to keep in mind, if you want to go to graphic number 5, we talk about all these macro numbers, and some people's eyes might glaze over. And I love this stuff. And to me, I find it very comforting. I find numbers very comforting, especially in this chaotic world. I like things to add up, and I like to, but the important thing if you're just talking to your neighbor is not to get involved in all these macro numbers, but just to say that the average family, making about $57,000 is going to save nearly $7,000 a year compared to what they're currently spending on healthcare. And then Bernie's plan, he's got it the way he structures his taxes. And I do have a graphic on that too, if you wanted to pull up number 7. So he kind of just puts together, when he released his 2017 plan, sort of a menu of options of things that add up to $16 trillion. Some favorite progressive revenue raisers. So he's got a little bit different mix, a 7.5% employer side payroll tax, and the average employer who's providing health insurance would net save $9,000 compared to what they're currently spending. So the average right now is $13,000 on the employer side for those premiums. And so this is a win for the employers that are currently providing health insurance. They don't have to have all that headache. They net save money. But for employers like Amazon and Walmart, who have been screwing over their employees and dumping people on the Medicaid system, they're going to be kicking in the 7.5%. Oh, woe is me, right? So, and then Bernie's got like a 4% income tax on taxable income. So I kind of like that one, because I was thinking, like, with people like my husband, who he doesn't have any payroll because he's retired. So, and he's not over that high income. So I'm like, he goes from paying $350 a month in premiums for all the different things, his Part B Medicare premium, his supplement, his dental premium, to now all of a sudden he doesn't contribute anything. So I kind of like having a little income tax in there for people that we can well afford to pay something,
Mm-hmm.
So that would be okay. So that kind of gives another menu of different kind of revenue raisers that Bernie puts together. And he focuses, when you hear Bernie talk, he focuses on that the average family is going to save $4,400,
Mm-hmm.
the way Bernie is going to save $4,400 compared to what we're currently spending, right? We have to do the Bernie voice.
That's a perfect.
And the average
Bernie
employer
voice,
is going to save $9,000. You're going to net save. So I think let's see if we had anything else of the graphics I put together. So the other thing is, when people say we can't afford it, I like to say we can't afford our current crazy quilt system. This is graphic number 13. I kind of did a snapshot of, and I have graphics going over each one of these numbers, but I thought this is kind of a nice snapshot that people can share. So we can't afford our current system, either economically or morally. The more important thing, morally, we can't afford this. So you see, we spend $3.3 trillion a year, and that's 18% of our economy. And 2/3 of that being tax finance. Works out to over $10,000 per person, which is more than twice the average of all other civilized countries. We saw, over a decade, that's if you're looking at 2018 to 2027, that's our current system, $49 trillion. Over that later decade, it's nearly $60 trillion. That's our current system. The average employer is paying $19,000, or the average employer plan is $19,000, with the employee paying about 30%, about $6,000, and the employer paying $13,000. We talked about we have over $500 billion in just waste of paperwork and headache. We have 31 million people still uninsured, completely uninsured, and probably another 40 million people underinsured where they can't afford the deductibles and copays, so they still don't go to the doctor. That translates into about 1 in 1,000 of the uninsured die each year just because they didn't get to the doctor quick enough or the hospital. And so that's 28,000 people dying, and then about 600,000 bankruptcies a year. The majority of bankruptcies have, at least in part, are due to medical bills. So this, can you imagine if we just had Medicare-For-All and you don't have to fill out paperwork, figuring out what your insurance is going to pay, whether it's in network or out of network, whether you're going to get a surprise bill like the guy who just had a heart attack, went to an out-of-network emergency room. And I don't know if you heard that story.
Yeah.
And his insurance, he was insured. He was a school teacher. The insurance paid $55,000 for what he needed done, which was more than the average for that procedure in those days in the hospital. And then they balance billed him $108,000 because the hospital wasn't in network after they told him, don't worry about it. He's in the hospital bed having a heart attack.
Yeah.
I mean,
which most people, I think normal people probably wouldn't be thinking about insurance in the midst of something like that.
Yeah. So how can you put a price on just the relief, just the lots and lots of peace of mind of not having to worry about all of that anymore? I mean, I'm very healthy, but I always worry about these I do all my due diligence, but you always worry that some out-of-network anesthesiologist or pathologist or somebody you don't even see is going to touch you. And then you're going to get some bill that's like, what?
Yeah. The way, I think the main takeaway after seeing all of these slides and whatnot is we have to change the narrative from how do you pay for it to how can we afford not to switch to Medicare-For-All. The one thing that I want to ask you that I think maybe we can end with is what your advice would be to someone like Alexandria or Ayanna Pressley or Rashida Tlaib. How would they answer the question if it's asked on CNN and they only have like a minute? What would you say to them? What would you touch on? What would you emphasize? Because obviously you're not going to be able to get all of this information in there. How would you answer that question if you could condense it all down?
Yeah, so I think the first thing which Alexandria did beautifully in her recent interview with Chris Cuomo is to push back on this, how are you going to pay for it question, that point out you never asked that for all of these other things when it comes to the corporate welfare and the wars and the increase in military spending and the tax cuts. You never asked that. You never ask the pay for question. So I think that's a really good way to start, just point that out. Like the corporate media is so obsessed with the fake neutrality. Oh, we have to treat both sides the same, but they go overboard. But somehow or another, they don't ask the pay for question. Maybe because they get all this advertising money from big pharma.
Yeah, it might be as if they have an agenda.
Yeah, exactly. So that would be the first thing I would do, and then I wouldn't get in. I would emphasize the savings, which I think Bernie, if you watch what Bernie does, when he emphasized that 2 trillion savings, boy, is that pissing off Charles Blauhaus and because what he's saying is so true. So say, that compared to our current system, we will net save $5 trillion, whatever you're comfortable. I'm sort of comfortable in that 5 trillion until I do a more deep dive into the other one. But we'll even according to the libertarian, we'll net save $2 trillion. Surely we can figure out a way with all the money sloshing around in the system that we're going to save money so we can afford to spend less.
Right.
Duh. And that of course, federal spending is going to go up. That's not a glitch. That's a feature of single payer. Listen to the word single payer. But all it's doing is replacing money that's already being spent inefficiently in our current system. So I don't know if that's like an elevator pitch. Focus on savings, push back on the pay for question, at least get that in there and say, hey, I'll play, I'll accept the challenge. I like to say, I don't think I should have to play, but I'll accept the challenge.
Right. We're playing by their rules and it's unfair, but still you have a nice list of bullet points that they can say. So I think that's very helpful. And I just want to emphasize to viewers that if you like what Andrea, I almost called you Alexandria, is saying here about Medicare-For-All, it's not just like you only analyze Medicare-For-All. You do everything else. So please tell us where we can find the rest of your analyses, your website, your YouTube channel, because I think all of this is so fascinating.
Okay. All right. So my website is ConnectTheDotsUSA.com. So you got to have the USA in there. You can also do ConnectTheDotsLady.com. People started calling me, oh, there's the Connect the Dots lady when they see me. So I kind of got that one too. So ConnectTheDotsUSA.com. And that's where you can download. I try to make it really user-friendly. It's by topic. So you'll see topics like, dude, where's my job? Budgets and deficits and debt. Oh my. Medicare-For-All saves lives, saves money, so simple. The American Healthcare Crazy Quilt. I also have one on political framing language that's great for progressive called Spinnervention, Frame Yourself or Get Framed. And so I have the full presentations, and my biggest challenge is trying to keep them up to date. So sometimes those PDFs get a little out of date, but I tell people go first to the single JPEGs where I've got them organized by category, and they're all kind of follow in order. And then you can grab those. They're free to share online, put them on Facebook, Twitter. You can also come over to my Facebook page and just grab, the graphic, and I do a little blurb with it, I kind of use it as my blog. So that might be an easier way to do it. And then also on Twitter at ConnectDotsUSA, because the other one was too long. So ConnectDotsUSA. The easiest thing for my YouTube channel, because I'm new, so I'm like a little grasshopper when it comes to YouTube. So I don't have a custom URL. So the best yet. So hopefully people subscribe and click the little bell, hit the subscribe button so I can get a custom URL. But for now, the easiest way to get there is to go to my website, ConnectTheDotsUSA.com, and then go in the lower left corner where my little character of me, and you'll see the links for my Facebook page, Twitter, and my YouTube channel. So
all right, well,
that's the easiest way to get there.
Yeah, thank you so much. This has been super, super insightful. You did something that none of my math teachers have been able to do. You got me to understand really complex, large numbers. So thank you so much, Andrea.
You're welcome. It was a pleasure. Thank you so much for the opportunity, Mike.
Support this podcast by becoming a patron at patreon.com/Humanist Report.